Welcome to North Tees and Hartlepool Voices, telling the stories of our people and community in our trust.
Hi, and welcome to Radio Stitch. In the studios today, I've got Kath from Make Every Contact Count, and she's going to tell us and give us some awareness of what it actually means. Hi, Kath.
Hi Andrew. Hi, I'm Kath Tarn. I lead on Making Every Contact Count here at North Tees and Hartlepool NHS Foundation Trust.
Hi, Kath. So tell us, what is Make Every Contact Count?
So Making Every Contact Count is an approach to behaviour change. So it's about using the interactions that we have with people every day in healthcare and communities and with our families as well, to have a conversation that will make a difference and influence someone to choose a healthier behaviour.
So is that like, I don't know, say a patient that comes in and they don't know what the options are and they don't know who to contact. Is that where you say make every contact counts? Does that sort of say, right, okay, then we can point you in the right direction. These are the people that can help you. And then obviously you'll send them there or wherever, point them there. And if they make that contact, that's basically what it's saying, isn't it? Make that contact, which is going to make your life a lot easier and better in the future.
So our ask of patients is to expect a conversation about health and wellbeing when they come to our hospitals. We want to know about your health and wellbeing. We are interested and we want to signpost you to be able to change behaviours that are important to you. So to support us to help do that, we've got a MECC Gateway, which is a website which has all the services that are available in our region. So for our Hartlepool patients, Stockton patients, Peterlee patients, and patients can access this website for different parts of wellbeing. So the core elements of MECC, to name just a few, are to improve physical activity, to support with mental health, to reduce smoking, to promote healthy weight, reduce alcohol. But there's many other options on there around making every contact count.
What's the website address?
The website address is www.meccgateway.co.uk/North East North Cumbria, NENC.
So anybody who wants to look at that can actually join onto it and look on the website, and they can actually access all those positions that you've just mentioned and everything else, rather than smoking and give contact to yourselves. Would a member of the team actually contact them after that, or?
The Gateway works as a resource so that there's contact information on each page that might be relevant to that person. So if the person wants to stop smoking, the website has information on there that helps someone to do that, whether that's a national initiative or something local to us, and we'll have contact information on there. The gateway is what it says it is. It's a gateway to other services. Yeah,
so basically you're just opening the gate and it's widening your world as such.
Yes.
Especially on the World Wide Web, as they say, which is great. And like I say, moving forward with MECC and things like that, where do you see that the future is with it? How do you think it's going to progress and get bigger and bigger? Is that only with the interaction of other people and staff and obviously patients that are out there?
Yeah, so MECC is for everybody, and we recognise that our population, particularly in Hartlepool and Stockton, we have higher prevalence of people who smoke, of obesity. We have higher prevalence of physical inactivity and alcohol admissions to hospital.
Yeah, I remember talking to other members of staff, and especially off the alcohol awareness team and things like that. COVID had a lot to do with it, because obviously people were stuck at home and it was just easy to go around the off-licence or the supermarket and get 24 cans of lager, or these shops that are open 24 hours. And obviously when you're bored, and people who are smoking smoke more as well, because they're just sat at home. So yes, and eating more. So yeah, you're covering every boundary as such, and hopefully obviously making people more aware of this and making them healthy as well while doing it.
Yeah,
which is great.
So MECC is one of our key priorities as a trust, as part of our health and wellbeing strategy, and we're on a journey to challenge culture through a change programme to become a healthy hospital. So we have support from the regional team across North East and North Cumbria, and North Tees and Hartlepool are a leading trust in the implementation of MECC across the region. So we have support from staff is to act as role models, to have healthy conversations with each other and with family, and to have healthy conversations with patients where the possibilities lie. MECC isn't about taking up clinical time that should be invested in a clinical decision. It's about taking an opportunity for a brief or very brief intervention that could signpost someone to a better life.
So basically a member of staff who's got a member of their own family or everything like that can just sort of say, look, have a go, get onto that website. It'll open your eyes to a lot of things and to where to go to gain help for the well-being of themselves, basically.
Yeah. And it doesn't just stop with the website, it also is about who you know and what you know. So if you know that there's somebody who's managed to have a successful behaviour change in their life, you think they could influence somebody, then pointing someone to have a conversation with that person might be useful. And it's also about knowing what's available in the community outside of the gateway as well, and acting as community connectors to influence our population.
Yeah, the way I see it, it's a lot to do with support as well, and that's what's needed. It's good having that contact, it's having the support with it, and having a team like yourselves that's there willing to give that support to staff, patients, anybody that's out there, friends, neighbours, whatever else. They always say it's if you know somebody who's lonely, just give them a call. It will boost them up, and that's having that contact. It's knowing somebody that's out there and knowing somebody, well, okay, Audrey next door, I'll give her a knock and go in and have a cup of tea or whatever else. Again, it's all contact, isn't it?
Yeah.
And that's what you are doing, which is great.
And I think at that level as well, Andrew, there's also great importance on partnership working, because we know there's health inequalities in our communities. We know that people don't have the same opportunities, and it's not just as easy as asking somebody to be more physically active. There might be other reasons why they aren't, and we want to adopt a personalised care approach to our interactions and our interventions so that we find out what matters most to people. We work at a system level to understand our population, understand what the barriers are to achieving health and healthy lifestyles, and we are able to provide opportunities, work with local authorities, work with our voluntary sector to provide opportunities that mean something to the people of Hartlepool and Stockton.
Well, that is absolutely fantastic. I'd like to thank you for coming into the studios today to have a chat with us and things like that. And hopefully we can progress this and give you some awareness. Like I say, Radio Stitches out there broadcasting throughout North Seas and Hartlepool. We're even on the TVs and hopefully going over to James Cook very shortly. Thank you very much, Kath, for coming down and seeing us. And if we can help you in any way in the future, please do. Just give us a refresh on the website and how people can get in touch with you.
Yeah, so making every contact count. The website is www.mecgateway.co.uk/NENC. And my final ask of Andrew today is, what opportunity do you have, Andrew, to make every contact count today?
Well, in the Radio Stitch network, we have a lot of contacts out there in the communities. Like I said, now we're reaching out to other hospitals, other community sectors like Peterlee, Lawson Street and things like that. Plus I have a lot of contacts from my industry over the last 30 years of being in the hospitality trade and things like that. And again, now I have the time to sit down and think about people, I will definitely be making that contact count. So yeah, we'll push forward and we'll give you some backing and we'll get you some awareness out there, and hopefully we can grow this for you. Thank you very much for coming in, Kath, and don't forget, make every contact count.
Thank you, Andrew.
Thank you for joining us. Till next time, you've been listening to NTH Voices.